Okay, looking at the different anatomy of the kidney, the brown here would represent the fibrous capsule that surrounds the kidney. It basically seals it off from, if you get infection in the kidney, it's spreading to other organs. You would have an adipose cushion capsule around here too that just helps protect the kidney through protection, absorbing shock. And going into the kidney at the indention, which is the hilus or hilum, which they have the ureter, the renal artery, and renal vein coming in and out of it. 2, this is your renal artery. As it actually makes its way into the kidney, it splits. This would be a segmental artery. The segmental split and come up between the renal pyramid, so this would be your interlobar artery. Then they arch above the base of the medullary pyramid. This would be your arcuate artery. Then they extend upwards. These are your cortical radiate arteries, also known as interlobular arteries. And then here, very, very small, it kind of looks like, if you imagine the corpuscle is the cherry, it's like the little stem going to the cherry. So the stem would be your afferent arteriole, and then this would represent your renal corpuscle. This is just showing you 2 different nephrons, showing you about where they position in the kidney. This is your collecting duct, and then if it gets here, the lighter portion, this is the papillary duct. Okay, you can also know that because your renal pyramid is this whole structure, and this light tip portion, this is the papilla or the apex of the medullary or renal pyramid, where the arcuate is, that's what we call the base. Blood, when they go through capillaries, it gets dumped back into the cortical radiate veins. So these are blood you want to keep in your body, so you're assuming most of the waste, nitrogenous waste, have been taken out. So your cortical radiate vein dumps into your arcuate vein, which dumps into your interlobar vein, which dumps immediately into the renal vein, which will then go through the inferior vena cava into the heart and through the pulmonary circuit to oxygenize it. The pathway of urine, right? Urine or filtrate enters the nephron tubules, and whatever fluid remains and does not get back absorbed into the blood, the filtrate will become urine in the papillary duct. The urine gets picked up by a minor calyx, where 2 or more minor calyxes dump together. That would be referred to as a major calyx. So you have 1, 2, 3 major calyces all dumping into the renal pelvis, and then the renal pelvis basically narrows and becomes the ureter.